Go.
Okay, so we're gonna go through all the bony palpations. We're gonna talk about what the bones are, what they, why you palpate them, and then show you where they are. So we have our cute little foot model here, and then we have our real life foot model. So the first thing we're gonna do is just palpate our medial and lateral calcaneus. So we know the calcaneus is the heel bone. So the medial calcaneal or calcaneal border is right here on the inside, on that medial side. And then you have your lateral calcaneal border. It kind of makes like a horseshoe or a U. And that is where you'd palpate for growth plate problems. And the growth plate injury that you'd have there would be called Sever's disease. S-E-V-E-R'(S) disease. So Sever's disease is right there, and you're palpating and looking for pain. All of these are pain, so we're not gonna go. Sever's disease, yeah. Then you have your medial malleoli. So medial malleolus, we talk about that with ankle taping a lot. Does anyone know why we'd palpate the medial malleolus? Fracture. What else? Dislocation. Okay. So fracture and dislocation, we're palpating the medial malleolus. And then we have our navicular. So if you look at this like foot model, you have your cuneiforms, your cuboid, and your navicular. Your navicular is kind of like a more like rectangular bone right there on that medial side. So if I, essentially what I normally do, can you bend your foot for me? I would find their first metatarsal, and you can see there's like a little like hump of the first metatarsal right there, and it's just posterior to that. So first metatarsal, and you're finding this spot right there, and this is where the navicular would be. What would happen to the navicular bone? A fracture. Good. And then you have your cuneiforms. So there's 3 cuneiforms. Your navicular was here. Your cuneiforms are just distal to that. It's medial, intermediate, and lateral cuneiform. So if you go and you find the top of your first metatarsal, that's going to be the first cuneiform. Your second metatarsal is going to be your intermediate cuneiform, and then your third metatarsal is going to be where your lateral cuneiform is. All 3 of those are for fracture. So you palpate medial, intermediate, and lateral cuneiform for fracture. And then on the lateral side, we have the cuboid. The cuboid's on the outside. Okay, so if you look, there's a little pouch of soft tissue that sits right on top of that cuboid, and that's where the cuboid is. So in this model, you can see it's like nice and big here. And then on their foot, there's a little soft tissue pouch, and that's generally right above where the cuboid is. You palpate the cuboid for a fracture. Good job. And then on the medial side, we also have the sustanaculum tali. Okay, so sustanaculum tali is a spot on the calcaneus. So if you look on this calcaneus, there's a little like part that goes up. And so that part where this ligament attaches, that's going to be called the sustanaculum tali. So what you do is you palpate the medial side of the calcaneus. And so if you're at the medial border and you kind of go more superficial to that or more like anterior, you'll feel a hard spot and it kind of hurts or feels like sensitive, and it's like right here. Your sustanaculum tali is on the inside right there, and that's where the spring ligament on the bottom of your foot and your deltoid ligament attaches. So I palpate that for a spring ligament or deltoid sprain with a P.
What are you looking for?
All of these are just looking for pain. Yeah. And then we've already gone over lateral calcaneus. Our lateral malleolus obviously is the malleolus right on the outside. We palpate the lateral malleolus for a fracture or a dislocation. What bone would be fractured if I have a fracture of my lateral malleolus? Fibula. So it'd be a fibula fracture versus your medial malleolus would be a tibia fracture. And then I have my fibula, obviously. So lateral malleolus, fibular head, which we remember we find by finding the joint line. Distal and anterior would be fibular head. So between the fibular head and the lateral malleolus would have my fibula, and you're palpating that for a fracture. And then I have my cuboid, which I already did, was the soft tissue cuboids on the outside right there for a fracture. And then I have the base of my let's go phalanges and metatarsals. So what do I call my big toe? Hallux, and I also call that what number?
1.
Number 1, okay? So number 1 of my hallux, I have this distal part would be my distal phalanx. And then I have the joint between my distal phalanx and my proximal phalanx, which I would call the IP joint or IP joint. So I have my distal phalanx, my IP joint, and then my proximal phalanx. And then I have this long bone right here, which is my metatarsals. Good. So my metatarsal, my first metatarsal, my second, third, fourth, and fifth. And when we palpate it, we want to palpate it all along it, and then we get to our cuneiforms just behind those metatarsals. So there's some special like metatarsals that we talk about, and specifically the base of the fifth is really important. So my fifth metatarsal would be on this lateral side, and if you slide your finger, you palpate all the way to the end, you'll feel the base of the fifth metatarsal. We call the end of all of our metatarsals the bases, and specifically the fifth metatarsal we care about. Why do you think we care about that? Huh?
A specific fracture.
So a specific type of fracture, a Marcher's fracture would happen to the second metatarsal. The fifth metatarsal gets what's called like a Jones fracture, or a base of the fifth metatarsal fracture. So it also like sticks out more laterally than the other metatarsals, so it has a lot of stress, and you also hit it a lot, and there's a lot of pressure when you're running. So fifth metatarsal, the base of the fifth metatarsal, tenderness there would be a Jones fracture or a metatarsal fracture. And then I have my sinus tarsi. So on the medial side, what did I call that thing that was on my calcaneus? Sustanaculum tali. And I remember that the sustanaculum tali is medial because it's sus if someone's inside your house, okay? So it's on the medial side. So sustanaculum tali is on the medial side, versus on the outside I have what's called the sinus tarsi. If you look at the model here, so I have this little gap between my, what bone would this be? The talus and the calcaneus. There's this little gap on the lateral side distal to that, and that's called the sinus tarsi. The sinus tarsi is just where blood vessels and nerves run through it, so it's not necessarily a structure you'd fracture because it's like a hole. So that is going to be on the outside, and if he turns, you can see he has a little bulge right there. Right here would be where that actually it'd be distal to that, so it'd be right under that. So that's gonna be where my calcaneus and my talus is, and so that structure where that runs right there, that would be the sinus tarsi, and you do that for sinus tarsi syndrome. So it's kind of like tarsal tunnel syndrome, but it's of the sinus tarsi. And then what else do we have? We have our fibular head. We did that last unit, so that's at the knee, but we talk about the fibular head with the ankle, because if you have a fibula fracture, you should double check. So you find the joint line, distal to the joint line, and it sticks out. That's your fibular head, and you palpate that for a fracture or dislocation. We've already done fibular shaft. Tibial plateau, remember that was the bottom of your joint line. So if it's the tibial plateau, is it medial or lateral? Well, it could be on both sides. That was a weird question. But you have your medial tibial plateau and your lateral tibial plateau, and that's for a fracture of the plateau or a dislocation. And again, we're talking about that in the foot unit only because it's the most proximal part of the tibia. And then we have our tibial shaft, talus and talar dome. So the talus sits like under the tibia and fibula, but on top of the calcaneus. So it's kind of hard to actually palpate the talus. What you can do is I bend their foot a little bit, and you want to turn, and you can put your fingers right at this anterior part of his foot, and when you turn, you'll actually feel the talus moving back and forth. So you palpate it right here at the anterior spot, or you can put your hands here, and I can actually feel the talus move back and forth. And I palpate the talus for a fracture or a dislocation. And then I have the joints that I have. So we talked about the big toe as the IP joint. The small toes have a DIP joint, distal interphalangeal, and then a proximal interphalangeal. What do I call the joint where my metatarsals meet my phalanges? Where my metatarsals meet my phalanges? Metatarsophalangeal, don't overthink it. So I have my IP, my DIP, my PIP, and then I have my MTP, so metatarsophalangeal joint. Then I also have what's called my mid-tarsal joints. So my mid-tarsal joints would be up here between my cuboids and cuneiforms and all of that. I'd palpate any kind of ligament for a sprain. So the joints or the ligaments are both being palpated for a sprain. And then I have my calcaneal tuberosity. So we're talking about on the posterior side of our calcaneus, right where the Achilles is inserting. So my calcaneal tuberosity or tubercle is right where the Achilles attaches at the back of the calcaneus. So I'd palpate that for an Achilles rupture.
Our agenda items are pulled from the board meeting tonight.
Awesome. Okay, so we have calcaneus here. We have calcaneal border, we talked about was for Sever's disease. And then I have my sesamoids. So that's also on that plantar or posterior side. So my, what am I saying?
Sesamoid.
My sesamoids, there's 2 of them, and they're on the distal part of my first metatarsal. So you can start at the arch right there and you push until you feel it, and you'll feel 2 distinct little bumps. And the injury that happens at the sesamoids is either a dislocation, which is kind of rare, but you can also get what's called sesamoiditis, which is inflammation of the sesamoid and the ligament that holds it together.
Those are also bipartite, maybe.
Most graders are bipartite. And then I have my dorsal spot. So if I'm looking at the top of my foot, we already talked about our phalanges 1 through 5. We talked about our metatarsals. Our tarso-metatarsal joint, we haven't talked about that yet. So where our metatarsal meets our tarsal, so where I meet my cuneiforms and my cuboid, that's called the tarso-metatarsal joint. So they're like basically like right where you see the bump of the first metatarsal going across here. That's a super important palpation to do, and we don't want to miss it because that's where you get what's called a Lisfranc injury. Lisfranc. Lisfranc. Lisfranc injury. And those Lisfranc injuries are like actually really detrimental to people's like activity, and a lot of times you have to have surgery because it separates those 2 bones, and they actually call it a fracture even though it's a sprain because it's such a big deal. And then we already talked about MTP and IP joints. Thanks.